Hi, good afternoon. It's Lunchtime Live with Dr. Leslie Wakefield. I'm a pelvic health physical therapist, and we do this every Wednesday at 12:30. That's a very royal we. It's just me. Today I'm actually traveling, so I'm doing the Lunchtime Live from the Dominican Republic, actually. I'm on a bit of an introvert's recharge and in introvert heaven. So I hope you guys don't mind. We got a little bit of pretty background back there. The question for today had to do with postmenopausal vaginal dryness. And basically what is there besides estrogen topicals that can improve postmenopausal vaginal dryness. So I thought we would talk about what that is in the first place and then some of the other options that are available, because while the estrogen topicals are the gold standard of treatment, and frankly they work with relatively little risk as far as we know, not every woman or person is comfortable using them, right? So let's talk about, I'm sorry, this is my notes that I'm looking at. I don't have my usual setup here, so I'm kind of winging it. So postmenopausal vaginal dryness, also known as vaginal atrophy, atrophic vaginitis, vulvovaginal atrophy, all of those terms indicating issues with the vulva, which is the outside of the female genitalia, the vaginal canal, and actually the newest term, which is a little bit better, but I still have some issue with it, is the genitourinary syndrome of menopause. And the reason it's maybe a little bit better is because it also talks about the urinary system. Having decreased levels of estrogen does change the skin at the vulva, the vagina, but also can affect the urinary tract. So a lot of women, as estrogen starts to decrease, not only are they getting kind of itching, burning, dryness, pain with sex, but they might also be having urinary tract symptoms, frequent urinary tract infections, UTI-like symptoms without actually having any bacteria in the culture. So in that sense, this newer terminology, which is the genitourinary syndrome of menopause, is a little bit more representative. It does reflect a little bit better what some of the symptoms are that people experience. My only issue with it, and I'm probably going to get slammed for this, is why are we calling it a syndrome when it's a natural response to a decreased level of estrogen? If those tissues in the body are estrogen sensitive, and a woman's body going through the natural phases of its life starts to decrease in estrogen, those symptoms that are popping up are biologically, kind of expected, and calling it a syndrome to me pathologizes it. Although I'm sure the other argument is, well, it is bothersome to many women and affecting quality of life, and giving a name for something and calling it a syndrome does raise awareness and does make it easier to address and treat. So I understand both sides of that argument. It gives me a little bit of an itch in the wrong place to feel like we're pathologizing something that is a natural biological process. But even so, it is a little bit more of an accurate term. So let's call it that. Let's call it the genitourinary syndrome of menopause, and we can be aware that people that experience this, it is because of decreased estrogen levels, often because of menopause, but not always. If someone has been treated for cancer, if they're on drugs that suppress hormone production, even women who are breastfeeding or have been for a long time can have decreased estrogen levels and then start to have some of these symptoms. So while we think of it as a menopause-related syndrome or set of symptoms, it's not always. This can happen to younger women, reproductive age women, and like I said, even women who are breastfeeding can experience some of these symptoms. It simply has to do with the fact that these tissues are responsive to estrogen, and if for some reason estrogen levels in the body are dropping, the tissues will start to experience changes. So the first recommendation, and I'm going to focus not on the urinary tract symptoms, that could be a whole nother discussion. There's some really great supplements that can be used. Again, the estrogen topicals tend to improve a lot of those symptoms, but let's focus on the vaginal dryness because that was the specific question that I received. And what can be done about this beyond using an estrogen topical, which I will say one more time, they work. It's a very effective, it's pretty much the gold standard treatment for this, but not every woman is comfortable using it, or maybe it's not enough. So what else is there? The first line of defense that's usually recommended by doctors is to use vaginal moisturizers, vulvovaginal moisturizers, and vaginal lubricants. And those are two different things. So let's talk about what both of those are and how probably you should be using both if you're having these symptoms. Again, the vulva is the outside of the genitalia. That includes the clitoris, the inner lips, the outer lips, the perineum, and the vagina is the canal that leads up to the uterus if you have one. So these are two different structures. They have two different names, and you might be using two different products. A vulvar moisturizer usually goes only on the outside. It typically comes in either like a creamy lotion or even in a balm. They have some that have, there's all kinds of different moisturizing agents that are in them. They function to moisturize the skin and also protect the skin so that it improves issues of friction, or if there's sensitivity, for example, like chemicals in laundry detergents or even tissue paper, toilet paper can cause irritation for some women. So the topical balms are used on the vulva and they function to moisturize the skin but also protect the skin. An internal moisturizer, on the other hand, usually comes in either a suppository, which is like a little pill, or a gel. And both of those can be put inside using like a tampon style applicator if you're not comfortable using your finger. They both have the same function, which is to moisturize and protect the skin of the vaginal canal. Some of them, most of them actually these days, contain hyaluronic acid, which is the same stuff we put on our skin products. And in the manufacturer studies, and take it with a grain of salt, this is coming from the manufacturers, but they're saying that the hyaluronic acid can give the same effects as the estrogen topicals. It just takes a little bit longer. So you're still looking at plumped tissue, more protected tissue, more extensible tissue, more elastic, more lubrication, but without the use of estrogen. There are a lot of these brands. Some of them you can order online, some of them you can get over the counter. I don't know that one is particularly better than another. I think we all sort of have our preference. But I can include some links when I post the recording of this video. So we have the vulvar balms and moisturizers. We have vaginal moisturizers, most of which contain hyaluronic acid, maybe vitamin E or something else that's good for the skin. Sometimes they contain agents that can help balance the pH and improve the I'm losing my words today. I'm too relaxed here. Improve the microbiome of the vagina. And all of those things can contribute to health of the skin and comfort of the skin. So then you move to vaginal lubricants. That's something totally different. A vaginal lubricant is used during sex or any other penetrative activity to decrease friction. And I suggest that you be using both. You can't really use a lubricant as a moisturizer. They contain different things, they do different things, and to the same effect, you can't use a moisturizer as a very effective lubricant. They're just not designed for that. So you would be using a moisturizer, a vulvar moisturizer, a vaginal moisturizer, probably on a daily basis, and then you would use a lubricant if penetration was expected. The lubricants usually come in either a silicone base or a water base. For someone with menopausal related dryness, I suggest a silicone base. It's like a slippery slide. That stuff never gets tacky, it never absorbs. It's a little bit difficult to wash off actually, but the issue with the water-based lubricants is they do tend to get tacky when they're exposed to air and over time, and when you really need a lot of lubrication in order to maintain comfort, probably the silicone based is your better way to go if you're comfortable using that. If not, there's really great water-based lubricants that you can try, about 1 billion different brands. Some of them contain things you want, some of them contain things you don't want, so you can do some research. Maybe that's a topic for another Lunchtime Live one day, is what the contents of those are and how they might affect your vagina. So I suggest in the case of postmenopausal dryness to use a silicone-based lubricant or a hybrid, which is a mix of silicone and water. But the silicone will reduce that propensity for the lubricants to get tacky and uncomfortable. And the goal of that lubricant is to decrease friction and protect your skin during any type of penetration, but we're probably talking about penetrative sex. Let's see, so we've got our moisturizers. vulvar and vaginal. We've got vaginal lubricants used for sexual activity. What else do I have on my list? We talked about the estrogen, and I'd just like to revisit it for a second because many women in this situation are using all three. They are using a topical estrogen cream. They are also using moisturizers, and they are also using lubricants during sex. And the estrogen, typically it works really well. It, as far as we can tell, is not really very much systemically absorbed. So there are many doctors that are comfortable prescribing it to women that have a history of hormone responsive cancer, or to women who are even breastfeeding, for example. Not all, but some doctors are very comfortable with that. There are a lot of women that even if their doctor says it's okay, they just don't want to. So yes, it does work. Yes, it's pretty readily available. Yes, insurance covers it in many cases, but not everyone is comfortable using it. So what does it do? Basically, it replaces the estrogen that our bodies naturally decrease over time, or in whatever situation you're in, if you are lactating, if you're breastfeeding, or if you have some other hormonal imbalance or disturbance. If for some reason you don't have that estrogen, it just replaces it in a very local way, and it stimulates those cells and helps them become more like they were before, when there was adequate estrogen. So now we move into a little bit more of the less studied realm of things, like what else is there? If you are using an estrogen topical and it's not enough, or you choose not to, and you've already tried vulvar and vaginal moisturizers as well as vaginal lubricants, but you're still looking for something additional, there are other treatments available. And I think the efficacy of those treatments depends on who you're asking. So, for example, there is the Mona Lisa laser treatment, and I've heard some really good reviews on that. I don't know that it's for everyone. I think that it's probably being used for things that maybe it's not really appropriate for. But I have heard from more than one person that it really worked well from them. Is it expensive? I think it is. And does it work for everybody? Probably not. How studied is it? I don't know the answer to that. But anecdotally, I'm hearing some good reports. I think that's something that you would want to talk to your gynecologist about. I'm aware that lots of different types of physicians are doing that treatment. Personally, I would feel most comfortable working with a gynecologist or someone that specializes in women's health. But that is an available option. There's, all right, so there's red light therapy. This is another one of those that's not, I don't know how established it is as a treatment. But I've heard some anecdotal good results. So red light therapy, it's quite expensive. It's for home use. It's like looks like a dildo. It's a wand, a treatment wand. It is surprisingly large. I can't imagine they wouldn't have made it smaller, understanding that the women who wanted to use it probably had discomfort with penetration. I don't know. It's a little bit larger than you would expect, but it produces heat and applies red light to the vaginal canal. And I have had a couple patients using it, and they like it. I don't know if that's applicable to everyone. I don't really understand the science behind it, but it is out there. It's on the market. It's being sold, and there's some anecdotal good results. It's for home use. It is a little pricey to buy, but then you have it theoretically forever, and you can treat yourself with it as much as you want. There's something that I was just exposed to recently. It's basically, am I saying this right? Shockwave therapy. I always kind of call it silly names in my head, and now I'm getting confused. I think shockwave therapy. It's called Cliavana. It's done around the clitoris and the clitoral hood. Not quite the same as what we're talking about. This isn't exactly for vaginal dryness, but they're using it in some cases to ameliorate postmenopausal changes in the clitoris. And let's see, dilators. Dilators to me can be really useful in this population under the right set of circumstances. If you have really sensitive, fragile skin, shoving a dilator up there is not going to help you. It's really not for that. But if you, let's say, had experienced all those things, and now you are protecting your skin, and now the skin is regaining its moisture and estrogen status, and now you would like to use dilators to work on improving any discomfort that's remaining with penetrative sex or any other penetration. They can be useful for that. But I would definitely suggest doing that under the supervision of a physician or a physical therapist who can coach you through how to use them, because in the end it is an object penetrating this area that is probably very sensitive and uncomfortable, and it's not necessarily appropriate for everyone. You might actually just be causing skin trauma if those other things aren't in place to protect the skin. So the postmenopausal dryness, it's to be expected because of the hormone status and the way that tissue responds to hormones. It is treatable. There are very well studied, proven techniques and things that you can use, mainly adding estrogen to the system, and that can be done topically. It doesn't have to be done systemically, but there's also a wide variety of these other products that you can use. We talked about vaginal moisturizers, vulvar moisturizers and balms, and vaginal lubricants for use during sex. There's also now a variety of different laser and light therapies that can be used, even sound wave therapy that people are using to try and stimulate those cells to have better blood flow and more elasticity. So I hope that was helpful. I feel a little discombobbled. I think, like I said, I'm a little too relaxed out here. But I will make sure to repost this video, maybe clean it up a little bit, post some links if that would be helpful to some of these products. I don't know all the products. Just because I'm listing one, it doesn't mean I think it's the best. It's maybe just one that I've been exposed to or my patients have used. If you found this helpful, please like. If you would like to see more, please follow. If you have questions, I would really love to hear them, because then I can answer them for you. I will repost this video on Facebook and on YouTube, and I look forward to seeing you next week.